everyone. Thank you so much for joining us. We have a very important and exciting panel discussion with three leading advocates who are fighting for our reproductive rights, for access to full reproductive health care here in New York and throughout the country. I do want to let you know that our sister organization, Women's Justice Now, has a robust resource center online for any services that you may need, information that could be helpful to you at this time, whether it's job related or health related. We certainly have a section on reproductive health care if you need it. So thank you again for joining us. I would love to welcome Tammy and Elizabeth and Ravina to join me. Thank you, ladies. So Tammy Boyd is the Chief Policy Officer and Senior Counsel at the Black Women's Health Imperative. It's a nonprofit organization created by Black women to help protect and advance the health and wellness of Black women and girls. Ravina, I'm gonna mess up your last name, Dafferty?
Dafferty, but good try.
She's the Director of State Strategies at All Above All. This organization's vision is to restore public insurance coverage so that every woman can get affordable, safe abortion care when she needs it. Elizabeth Smith is the Chief Counsel of State Policy and Advocacy at the Center for Reproductive Rights, a global legal advocacy organization. Thank you all for taking your time to be with us today. We know how very busy your schedules are. There certainly is so much happening in the world of women's healthcare and especially women's reproductive healthcare. So thank you so very much. I would love to start out by asking you about the evolution of how we're thinking about and describing reproductive rights. It's been going on for a while, but some people may not know that distinction because we talk, you see it interchanged quite a bit between reproductive rights, reproductive justice, and reproductive health care. Tammy, could you define for us reproductive justice?
Yes, absolutely. So reproductive justice is based on the full achievement and protection of women's human rights. It offers a new perspective on reproductive issues for women of color. It's important, for example, to fight for the right to have a child, the right for parents to parent your children, the right to not have children, as well as full control of your birthing options. And additionally, the framework is not just around, say, abortion by itself, but its ability of any woman to determine her own reproductive destiny, and it's linked to conditions in her community. And then specifically, a lot of times what we do, Black Women's Health Imperative, when we are talking to young women and we're educating them about reproductive health and reproductive justice, we sort of center the framework in, in reproductive health, which is service delivery. We also look at reproductive rights, which addresses the legal component, and then also reproductive justice, which really focuses on movement building. So it's really service, organizing, and advocacy. And so that would be just a general definition of reproductive justice. And as you mentioned, there are a lot of new perspectives that are sort of emerging around reproductive justice, but that is sort of the traditional reproductive justice definition.
Thank you. Do either of the two of you, Elizabeth or Ravina, want to add to that? Elizabeth, you work for the Center for Reproductive Rights.
I do. So what I would add is to say, I'm an attorney. The organization that I work for focuses on the law. So we are absolutely doing reproductive rights work. Although in the state policy work that my team does, we like to employ a reproductive justice lens, which means that we work to center those who are historically marginalized and also follow the advocacy led by Black women and other non-Black people of color. So we can use a reproductive justice lens, but our work is squarely in reproductive rights.
Thank you.
And I'll just add, All Above All is a multiracial campaign, and we do work across all three movements. So we do work across reproductive rights, across reproductive health, and reproductive justice. And for us, we use a reproductive justice framework in all of our work. It's foundational to our campaign from the beginning. The leadership, comes from reproductive justice organizations and from that movement, but to
Oh,
frame.
so, Ravina, you know what? I think you're.
Is my audio going out?
Yes, yes.
Okay, I'm going to call in, but
you're freezing up. So yeah, go ahead and call in again if you think that'll help. So I think that it's really important to start off this conversation as well, talking about what we're all going through now, and that is the health crisis in this country due to the pandemic. We're 6 months in. Can either of you, and Ravina when she joins, again, talk a little bit about how COVID-19 has, or our access to reproductive health care has been affected by COVID-19? What's happening? Here in New York City, one of the things that certainly soon when the hospitals were really under siege is a policy that was put into place where birthing women could not have an advocate or a partner with them while they were in labor giving birth. And it was really sad and heartbreaking to see. I mean, it was very scary for many of the women. That policy was eventually changed. The governor did an executive order to do that. But that's just one example. Can you talk about some other things that have been affected?
Tammy, I'm happy to follow you or to start. Either is fine.
Please, Elizabeth.
Okay. So I think all healthcare access has been affected by the pandemic. And when we look at reproductive healthcare specifically, there were 10 states that issued executive orders, as many other states did, telling providers and hospital systems to conserve personal protective equipment. But these 10 states, unlike the other states, went a step further and said that abortion care was either non-essential, non-emergency, or in some cases elective. And so in those 10 states, the executive orders were used to try to stop all access to abortion care, both procedural abortion and medication abortion. And so there was litigation undertaken by the Center for Reproductive Rights, by the ACLU, by Planned Parenthood, to stop those orders from being utilized to stop abortion care. Those orders have at this point all expired, but for instance, in Texas, abortion was not accessible for about 3 weeks, which is not something we have seen since Roe v. Wade was decided. And I'll just add, in terms of other reproductive health care, you're absolutely right. In New York and other states, there was an attempt to limit a support person in labor and delivery, which again, we understand that that policy was meant to stop the transmission of COVID. But what we know is that a support person can absolutely help create better maternal health outcomes for women in labor and delivery. And I'm sure this is something that Tammy can talk about more, but Black women have, I believe, an average of 4 times as likely to suffer adverse consequences while in labor. And so when we think about the aims of stopping COVID transmission, that's critical. But when we think about the fact that we really need to focus on, increasing Black women's health and safety while in labor and delivery, that support person is critical.
Ravina or Tammy, if you have anything to add. We were talking, Ravina, you might not have heard, just about the impact on access to reproductive health care under COVID.
I mean, I can just agree. I mean, I agree with much of what Elizabeth said. I mean, you know, during COVID and the pandemic, you know, it prompted many states to place restrictions that really effectively banned or blocked availability of services. And for Black women, you know, that sort of exacerbates, as you mentioned, the health outcomes. As you mentioned, Black women are 3 to 4 times more likely to die in childbirth. And so for us, we really tried to monitor Black women's health imperative, you know, what was happening to women in the hospital, you know, really advocating that that abortion is actually an essential service. It's not, it's essential to women's rights and to their health, and that it's not, you know, a non-essential or elective procedure.
I think the only thing that I would add, you can hear me now, right? Okay, great. Oh, it says my connection is unstable again. Okay, I'm gonna keep going. But if you can't hear me, I'll chat in. I think the other thing I would just put one point on is what Elizabeth said about Texas discontinuing care for the first time since Roe v. Wade. I think what I want to just pull out from that is that, you know, politicians will use any excuse, like anti-choice politicians will use any excuse, including a pandemic, to try and ban abortion, right? Texas has been trying to ban abortion forever. And so I think, you know, this was really, it would be one thing if the state of Texas was doing all kinds of really, you know, taking all kinds of aggressive measures to limit the spread of COVID during this time, but they were doing almost nothing. And so their only response to COVID was an attempt to block abortion access. And that was the case in other states as well, that were attempting to block abortion access. And so it really, I think, exposes this kind of like, we don't actually care about public health. We're not really doing everything we can. What we're doing is using any opportunity we can to push abortion out of reach. And it immediately, I think, politicizes the pandemic in a way that's, you know, just extremely harmful for all of us, extremely harmful for people in Texas, and it uncovers that there isn't really, I don't think, a true commitment to public health on the part of many of these politicians who have used it as an excuse and as a way to limit abortion access in their states for years. And then I think, you know, there was so much happening at the state level in terms of these emergency orders. But, you know, there was also, like, the federal anti-choice politicians weren't doing anything different. They were, you know, passing these COVID relief packages. And, you know, we would hear directly from McConnell's office saying things like, I don't want these relief packages. So if the Hyde Amendment or limitations on abortion funding and coverage aren't in these packages, we're not passing them. And, you know, we really should not be allowing anybody to be holding this kind of, like, very important relief back from people as they're struggling, you know, maybe the worst they've ever struggled in their entire lives, because of some kind of political issue. This wasn't even really about abortion funding. There isn't anything about abortion in the actual bills. This was purely symbolic, them trying to just wedge this issue in there so they could score some political points. And, you know, we're heading into the next round of negotiations on COVID relief packages. And, you know, the last thing we want is for these types of bans to be normalized within major relief packages. And I think that's what we're worried about right now going into this next wave.
Thank you so much. That is so important and so timely, and something that we all need to know about, so that we can be informed in terms of being the advocates and the citizens who are talking to our representatives whom we elect. Ravina, I was going to ask you later on, but since you've brought up the Hyde Amendment, can you go ahead and give us the one-line explanation for those who don't know about the Hyde Amendment, and the impact, the devastating impacts it has had on women in this country?
Yeah, so, you know, I was really glad that we did a poll at the top of the call, because now I really want to talk about the results. So for those who don't know, the Hyde Amendment, you know, if we go back in time, Roe v. Wade was decided in 1973, and almost immediately anti-choice politicians, anti-choice activists started to try and organize to get rid of Roe v. Wade, right? And they looked at all of their options. They looked at which policies would be most vulnerable that they could exploit. And really what they saw was the Medicaid bill, right? They said, we cannot necessarily ban everybody from getting abortions, but what we can do is limit low-income people from getting abortions, because we fund the Medicaid program, and the Medicaid program is how a lot of low-income people access healthcare in this country. And so in 1976, Henry Hyde, who was a freshman representative from Illinois, inserted the Hyde Amendment into the Medicaid bill. And essentially that bars Medicaid, and that's been expanded over the years to other federal programs, from covering abortion. So the impact of that, is extremely far-reaching. I'd say just like at a human level, for many people, I think something like 50% of people are not able to cover any $500 emergency medical expense. That's across the board in the United States. So when you think about that within the context of somebody who was already struggling to make ends meet and enrolled in Medicaid, whether or not you have Medicaid coverage for your abortion means the difference. It's the difference between whether you can get the abortion or not, right? And the longer you wait, the longer you have to, look around to friends, families, other people sell items in your home in order to make up that money. The clock is ticking on your pregnancy, and the procedure is getting more and more expensive. And so what we see as an impact of the Hyde Amendment is that 1 in 4 poor women who seek an abortion are forced to carry that unwanted pregnancy to term because of restrictions like the Hyde Amendment and other coverage restrictions. And we also see that a woman who wants to get an abortion but is denied is more likely to fall into poverty. And so it really does, the impact of it is devastating. And it was, I think, really an interesting reflection to see the folks that are on the call now who are, I'm assuming, primarily living in a state that has really good policies around Medicaid coverage, just to compare it with other states, because New York is one of 16 states that covers abortion in their Medicaid program. And that means the majority of states do not. And so it really, I think, has an extremely devastating impact. It's probably, I would probably say it's one of the most devastating restrictions on abortion. It was the original restriction on abortion. Honestly, it was the first restriction, and really set the stage for all of these other restrictions being allowable around abortion access. It impacts a huge number of people and really does limit people's ability to have autonomy around their pregnancies. And then I know you asked for one sentence, and I talked for like 85 years, but this is the last thing I'll say, is that you really can't separate the Hyde Amendment from the legacy of white supremacy and anti-Blackness in this country. If you look at the machinery of reproductive autonomy and reproductive oppression, it is really centered around the oppression of women of color and the reproductive control over women of color, right? That meant not just impacting whether or not, whether they have a child, right? And really, the stealing of slave children, the stealing of indigenous children, a legacy of forced sterilization in this country, those are all tied to the kind of original architecture of white supremacy in this country. And so the Hyde Amendment, when you look at, even though 40% of Medicaid enrollees are white women, Medicaid is disproportionately serves women of color in this country. And when it was passed in the 70s, that meant mostly Black women. And as immigration patterns have changed, we've seen the machinery of anti-Blackness be applied to every other marginalized group and racial identity group as they've grown in this country. So it's, I think, really important for us to be centering people of color, centering Black women particularly, because as we work to lift the Hyde Amendment and other restrictions, if we are not lifting them and centering Black women in that conversation, and if Black women are not able to access those services and have good policies that serve their communities, then we haven't really done our jobs.
Thank you so much. That is so very important. And it's so important always to acknowledge and recognize how every time that we have lawmakers who are anti-feminist, anti-women, the policies they put in place, first and foremost, bear down the hardest on poor Americans and particularly people of color. So thank you so much. Turning to something that's at least something positive that has happened recently. Elizabeth, could you talk to us a little bit? Talk to us about the most recent Supreme Court ruling in June medical services. Is that what it is?
Yeah, that's correct.
Yeah, June medical services.
Yeah, so the law at issue in this case is from Louisiana, and it's a law that required abortion providers to have privileges at a local hospital within 30 miles of the clinic where they practice. And this law was absolutely based on a law in Texas that went up to the Supreme Court and was the focus of a 2016 Supreme Court decision, Whole Woman's Health v. Hellerstedt. And so when HB2 in Texas was passed, requiring privileges at a local hospital, lots of clinics closed. And so Louisiana saw how effective this restriction was at limiting access and decided, we want that law too. And so they passed it. And then it got up to the Supreme Court this year. And a plurality of the Supreme Court decided that Louisiana's law was unconstitutional, just as Texas's law was found to be unconstitutional in 2016. So this was absolutely a win for people in Louisiana because it meant that all of the clinics in Louisiana stay open. I do want to underscore, though, that what this meant is that the status quo stays the status quo. And we know that there is not enough access to abortion care in Louisiana and not in many other states as well. So this is a win for folks in Louisiana. We were happy to see this outcome, but Chief Justice Roberts was in the plurality, and he did vote to find the law unconstitutional, but he made some comments in his opinion that potentially will be utilized by anti-abortion politicians in Louisiana, in Texas, in other states hostile to abortion rights to try to further limit access to care. So yay for this result for the folks in Louisiana who are working in incredibly difficult circumstances. But again, there is so much work left to do.
Elizabeth, is it 3 women's health clinics that are in Louisiana? Is that the status quo?
Yes, so there are 3 independent clinics in Louisiana.
In the entire state, as if that was adequate to begin with.
Right.
And what does that mean? What does that mean for a single mom who works at a job that she can't just take a day off, or when she does take a day off, she loses her wages for that day? And I don't know if there are waiting periods to get an abortion in Louisiana, but many states have that as well. So you're having to travel somewhere far, get a hotel, wait there for a day. It's putting poor women at so much risk. There's still just so much to do. Can you tell us a little? Also in Louisiana, though, there's something else that's coming up, a ballot initiative, and I think in Colorado as well. Can you? And I know that you're working on these. Can you tell us a little bit about that?
Yeah, absolutely. So in Louisiana, name an abortion restriction or an abortion ban, and they have the legislature has passed it, right? So there are lots and lots of restrictions that are both currently being enforced in Louisiana or have been enjoined by litigation. So in addition to the Supreme Court case, on November 3rd, Louisiana voters will be asked whether they want to approve a potential constitutional amendment that would add language to the Louisiana Constitution that would say, nothing in this Constitution protects the right to abortion, and nothing in this Constitution requires the funding of abortion. So, the folks who are working in Louisiana have been working in extremely difficult circumstances for a long time, and the kind of work ahead of them is to educate folks across the state about what this ballot initiative could do and why the Louisiana Constitution should not be amended to include this language. The Colorado ballot initiative is different. It's not a state constitutional amendment. It would create a new state law. But what it would do, if approved, is that it would say no abortions can happen in Colorado after 22 weeks. There are no exceptions, and it would just be a complete bar to care after 22 weeks. And, you know, Colorado is a very important state for abortion access, both where it's located geographically and also because right now there are no gestational limits in Colorado law. So there is nothing that says no abortions can happen after any period of time. And so advocates in Colorado right now are having conversations with voters in their state about why this, you know, ballot initiative would be so detrimental to access. And, you know, the things that they're talking about are, you know, abortions happen after 22 weeks for a variety of reasons. Some of those reasons are that the health of the pregnant person is in jeopardy, or, you know, the doctors have found that there is a fetal anomaly, or people from other states are going to Colorado for access because it's so difficult to get an abortion in so many states that pregnant people are pushed farther into their pregnancies before they can get access to care. And so for those and lots of other reasons, advocates in Colorado are having those conversations with voters to say, vote no. The last thing I'll say about Colorado specifically, I think we might all remember horrible things that President Trump said about abortion later in pregnancy in 2019. Because in Colorado there is a Senate race and obviously presidential race, there is a thought that this conversation about abortion later in pregnancy in Colorado could become a focus of the presidential race. And there is the expectation that the president and others who are hostile to abortion rights will use really terrible language to talk about abortion and specifically abortion later in pregnancy. I'll stop there because I know that Ravina is working on some of these too, and she may have more that she'd like to add.
Sure, Ravina, if you'd like to.
I don't think I have anything else to add. I mean, I guess the only thing I would add is that anytime abortion is on the ballot, we are reckoned, like a state has to go through a reckoning about what it believes about abortion. And I think, you know, some people, maybe even some of you on the call, might look at something like 22 weeks or like any kind of gestational limit and say, well, I don't know. But the point of this is that there shouldn't really be any types of restrictions like this on the books at all, because no other medical procedure, no other healthcare procedure has the state, and certainly not like the state population, weighing in on what any individual should be doing about their health. And so, you know, I think that's why we kind of draw these lines. And you know, there's many, many different reasons, for example, why somebody may need to get an abortion at 22 weeks. You know, my issue, for example, what I was explaining before, is one of them. And, you know, many people have trouble raising the money. It ends up pushing their abortion later. And the reality is that one of the major reasons why people even do end up having to have an abortion later than they might otherwise want is because of the restrictive landscape that we live in. Colorado is a state that has a Medicaid coverage ban. And so, you know, I think we have to look at the totality of this. And what we've seen, I think Elizabeth's probably going to be talking a little bit about evaluating priorities and that research. But, you know, what we've seen is that having a plethora of abortion laws on the books is actually correlated with having bad outcomes around reproductive health and maternal health. And I don't think we feel any differently about something like this.
Thank you. Tammy, your group, Black Women's Health Imperative, it does so much important work and in so many different ways. I really enjoyed reading an op-ed that was published recently, and I want to read from it, that pointed out that we live in one of the most technologically and medically advanced nations in the world, yet Black women are still 4 times more likely than white women to die during childbirth. School-aged girls in low-income communities miss 2 to 3 days of school each month because they don't have menstrual products. Can you talk a little bit about the things that you're working on to create better outcomes for women of color here in this country? Just let us know a little bit about what people are facing, and any actions that we as advocates and voters can take.
So it's just saying, generally in Black Women's Health Imperative, we really try to, think strategically. And what we've heard, thus far in this panel is that, there are attacks with the Hyde Amendment, the federal level, there are bans that are happening at the state level. And I know Rena mentioned, but for example, for the Hyde Amendment, there is a component where they include the Hyde Amendment in the labor HHS appropriations bill, and Congresswoman Presley is now working, and along with Congresswoman Lee and Representative Schakowsky to remove that ban. But we're always having to sort of monitor state level and federal level and what's on the ballots. So one of the things we are working on is from the other side of sort of the abortion piece is another end of the reproductive health aspect is menstrual equity. So Black Women's Health Imperative launched, it's called the Positive Period Campaign. And menstrual equity is really around the affordability, accessibility, and safety of menstrual products. In the CARES Act, which was one of the COVID relief packages, there was a provision that was included that we worked closely with the group to include where menstrual products are tax exempt in your health savings account or your FSA. And so we want to make that available where menstrual products are tax exempt for young women, for girls, for folks of reproductive age. And so another aspect we worked on is we launched our Positive Period campaign where we are donating 2,000 Diva cups to women and girls. We, during the COVID pandemic earlier, in Atlanta, we collaborated with United Way of Atlanta, and we gave out menstrual products. And so you just be amazed at how many women, which goes back to what Regina also mentioned in terms of the economic, being able to afford certain procedures, products just across the board. During this pandemic, women were having problems with that. And so we gave out menstrual products, and there were just lines of women that were lined up to get the products. On a policy level, we are working to where menstrual products are tax exempt. So that's one of the ways that we are working sort of to also educate Black women around reproductive health and sort of the full range of options, from your menstrual to menstrual equity to also abortion.
Thank you so much. Ravina, there is, I'm not sure, Tammy, you may know about this, the abortion fund that was part of the New York City budget. And if you know if this model is being used anywhere else, it's a way for New York City to be able to make up some for the Hyde Amendment and for the so many of the rollbacks. I don't know if you have any thoughts on that or any ideas of how effective it has been or helpful? Any of
and I can talk a little bit about that. And Tammy, I'm thinking like we got to get a menstrual product funding stream in the New York City budget too. So if folks have been paying attention in the last 2 years, New York City. So just I think people. One of the questions that came into the Q&A that I think we're going to hit a little bit later when we address them directly was around what folks can do, and I think we need advocacy on all of these issues at the city level, the local level, the state level, and the federal level. But one thing that we were able to do with our partners in New York City with the National Institute for Reproductive Health, which is based there, as well as the the New York Abortion Access Fund, or NIAF, which some of you may be a part of. Is get the city 2 years ago to actually establish a line item funding stream as a grant to NIAF. And NIAF helps people pay for their abortions. They help with logistical and practical support. They help with case management for people who need an abortion. And one thing I think that's really exciting about this fund is, one, New York City was the first municipality to do it, and shortly thereafter, Austin created a similar fund for their local abortion fund called the Lilith Fund. And so I think it is definitely one way that cities can take care of the residents in their cities that are subject to the Hyde Amendment. Even in a place like New York City, and New York State has great policies around this, but the Hyde Amendment reaches all kinds of different people. So they reach people that might be insured through IHS. They might, which is Indian Health Services. They might reach people who are insured because of veterans benefits, Peace Corps volunteers, federal employees. All of these people, even though they're living in New York and New York has great policies around this, are still subject to the Hyde Amendment and are thwarted from being able to raise funds. So NIAP, can still help. The City of New York can still help kind of close some of these gaps. And I think the other really exciting thing for those of you who are concerned about Roe v. Wade, around people having to travel for an abortion, for example, is that the New York City policy doesn't have any residency requirements. And that was an important piece for the council to take on because already people from across the country who are facing barriers in their states come to New York to get an abortion because it is considered a safe haven for it. And we only anticipate that as these restrictions get more intense, that we'll see more travel to more progressive cities where people can access that care.
Thank you. And that question that we have from Hillary, which we should just tackle now, since we're on the subject, is she says, in New York, we all on this phone, we worked on the Reproductive Health Care Act to get it passed, which would codify Roe v. Wade in state law. In Buffalo, Hillary says, we have folks coming from Ohio, Pennsylvania, and other nearby states to access abortion care. How can we as New Yorkers both improve our own legislation and advocate for others living in anti-choice states? Well, I'd like to answer that by starting with making sure that everybody you know is registered to vote and that they've got a plan to get to the polls or send in there, understand how mail-in voting works, because we've got to make sure that Donald Trump does not win another 4 years in the White House. He is by far the biggest threat to women's rights, reproductive rights, and all of our rights. I'll turn it over to you, to all of you and any of you. Did anybody want to have any thoughts on how we can help people who are living in other states?
So I can take, so one of the things that we've been doing is really educating and going to, for example, we did several, pre-pandemic, we did several sort of educational events where we went to states such as Mississippi, Georgia, Louisiana, and really, a lot of times because of the laws there, because of the red states, that they may not have access to that information. And so we would put together similar to like this panel, a group of experts to really just talk to Black women and women about some of the reproductive and really empower them to get out and sort of hold their elected officials accountable. We're going to re-release it this year, but we put out for 2018, 2019 a Black Women's Vote policy agenda. And the policy agenda also had a report card. And so we talked about the Black women's vote and the key issues that impact Black women. But then what we said is, okay, now you should go empower them to talk to their elected officials. And if they are not, if they don't support a right to abortion, if they don't support these key healthcare issues that impact your life, then you shouldn't vote for these folks. So I think, just really educating individuals about not only the importance of the right to vote, but also where do your elected officials stand on key issues?
Exactly. A playbook from the NRA is very, very successful at that, at holding those that they endorse to their highest standards.
Yes.
I can take a shot next. Oh wait, is that okay?
Sure.
Okay. So +1 to everything that Tammy said, absolutely. I think I'm really glad that Tammy brought up Ayanna Pressley's amendment that just went into, that was just introduced in the appropriations process, because, Tammy said this, that is where the Hyde Amendment lives. And this year we really did get as close as we've ever gotten to having Hyde removed from the budget. And it still didn't happen, right? Many of even our friendly, supportive members of Congress are not ready to actually cross the finish line with us. And that really can't stand. So I think, we're extremely excited about Congresswoman Presley's amendment, and she was joined by Barbara Lee. She was joined by local hometown hero for you all, AOC. She was joined by Representative Schakowsky, I think Judy Chu, and one other person, Dinah DeGette. So, we really need bold and assertive stances like that. Right now, we just cannot do this again. We cannot have another budget that the Democrats pass or introduce that has the Hyde Amendment in it. It's completely against our values, and it's against pro-choice values. So in that, I actually do have an action that we put together. I'm going to text it in. So everyone should take out their phone, and you can text, I'm going to write it in the chat, but it's bold, text bold to 52886. And that's a way for you to fill out the actual action to ask your member of Congress to stay strong on this issue and to support the Each Woman Act, which is our federal bill. You can sign up for All the Balls list, which you totally should, but you don't have to. You can just do the action if you want. And I think the last piece is that, so much of this work is local, right? Like we talked about the New York City funding stream. Other folks were talking about Buffalo. I mean, this work is work that you can do in your own neighborhood. You can talk to your city council about what they're doing. There are people in your city and in your town that are subject to the Hyde Amendment, even though your state is good on this issue. And so there's something that all of us can be doing. I would just encourage you to, not feel like just because this is a federal policy that there aren't things that you and your city and your town can do. And I see something to the chat. I did post the action, but I'll repost it in case people didn't see it.
What is it? It's hashtag bold.
You just text the word bold to the number 52886, and it will show you a link, and you'll click the link and you can go to the action.
52886. Okay.
And if I can just add
right.
on to,
I'm on my way.
quick.
Yes, please.
I completely agree with everything that Tammy and Ravina have said. I'd also add one way to support folks in states that have a lot more restrictions than New York does is to, financially support abortion funds that are helping people both pay for procedures and, pay and figure out all kinds of complicated or potentially complicated, logistical and financial hurdles to getting care. Independent clinics also across the country actually provide the majority of abortions, which is a fact that not a lot of people know, but it's true. So supporting independent clinics and helping them continue to provide care is critical. And then I think this was built into everyone's answer, but just talking about your support for abortion rights and abortion access to people who you maybe haven't had those conversations with before. Because part of the way that our opponents have been so successful on this issue is by making people feel like it's scary or frightening or inappropriate to talk about abortion rights and abortion access. And if we are all, to quote All Above All, if we are all bold, if we all talk about our support for this issue, it becomes a lot harder to say, it becomes a lot harder not to recognize that a majority of Americans think that abortion is a right and should continue to be accessible.
Yeah, exactly. It's been a taboo topic, something with stigma, and that has really worked against the making it open and bringing it out into the light and realizing that, it's I think the top medical procedure that women have in this country, that 62% of women who have abortions are already mothers, which points to a lot of the economic issues surrounding, planning your families. I have some questions from the audience. I was going to close with a question about what next we can do, but that has been certainly boiling up certainly in these last few minutes. So I've written some of them down, and maybe we can, before we'll close, if there's anything else. I mean, we have to make sure that we elect a pro-choice president, so that we have a pro-choice administration. We'll certainly have, with that, changing the makeup of the Supreme Court, supporting independent clinics. Thank you, Elizabeth. That's not something that we talk about a lot. Supporting the CARES Act is one of them, which I don't know if we'll be able to throw up the graphic that we used last year on it. But now the important work to take another step forward with the Hyde Amendment and to finally just get rid of it. The culture change, talking about it, being bold. So those are some of the things. So see what else you want to add to that before we close in a few minutes. But I want to get to a few questions that we have time for. We've got 10 minutes left, 8 minutes left. Kate asks, this is the first time I've heard the phrase menstrual equity, which puts the issue into an economic framework. Does this issue have bipartisan awareness and support? It seems so simple and obvious. Tammy, do you know?
Yeah, so it does. So we are still working. There is bipartisan support, but it's not broad bipartisan support. And they're also in like the various states as well. So there's a federal level in terms of menstrual equity, but then we're also working on the state level as well. And some states have, like Virginia, for example, has passed where there's no, where menstrual products are not taxed, but it's not across the board. Congresswoman Grace Ming is who introduced the bill. There's actual legislation, and which we're happy to send to everyone that participated, the bill number. But there is a movement on the Hill to really pass meaningful menstrual equity legislation.
Terrific. And in New York City, there was also a big push. Menstrual products are now available free of cost in middle and high schools. So that could be another area where more at the state level there could be action. Diana asks, what is the best way to find out congressional candidates' views on abortion if it's not something that you can find on Google? This is a real issue because abortion is not always talked about, even in the Dem debates, which is so true, town halls. Calling and asking these questions so candidates know they matter. Well, we have what you mentioned, Tammy, about the record, the reports on candidates' records. That's another thing, is a lot of times they work hard not to get legislation on these issues to the floor so people actually don't have a record on it. I mean, that's a strategy at times. Does anybody have anything to add to that?
I mean, you can definitely, for example, a lot of these things happen in the subcommittee level, as you mentioned. Like, it may not even get to the floor, but sometimes it may be in the subcommittee or the committee. So, like, for example, your Ways and Means, or your Energy and Commerce, or your Labor Age Approach. It just depends, and you can go and look to see like what their vote, how they may have voted. So even if they don't talk about it in a town hall, or even if it's, if you just Google it, it might not be there. A lot of times you can, find out what the key votes in Congress might have been around that issue, and then you can go back. And you don't have to just do this year. I mean, typically this comes up every single Congress. So you can just, continue to do research on those key legislative pieces. Like this Presley Amendment would be an example to see how folks voted. I don't know if others, Ravina or Elizabeth has.
I mean, I can answer with now we're going into our action fund hat. So we also have an action fund. Some of them will come right out and say where they stand on these issues. Many of them have been afraid to stand out or to say anything about our issue, about the Hyde Amendment, for years, right? So we're only just starting to step out, or getting them to step out on this issue. People will not necessarily be forthright about their views on these things unless they're pressured. So if there isn't a question at the town hall, be the one who asks the question, right? Put the question to them, put the pressure on them. You want to know where they stand on these issues because they're important to you, you're their constituent, and you're a potential voter. And, you know, there's too much of a dynamic around, you know, women's issues or issues of reproductive rights that they're not necessarily a core issue. Well, that's changing. That's changed considerably. If you look at the Democratic Party, I mean, there have been polls that came out after the 2018 election that showed that this was actually a top issue for Democratic voters. And, you know, so candidates really need to be stating their views on it, and it shouldn't be enough that they get to say that they're like good on choice, or, you know, they need to get specific about exactly what policy proposals they're supportive of and what they're going to do when they're, you know, potentially in office.
Thank you. Gosh, there's so many good questions here. Let's see if we can answer quickly so I can get through a couple more. We've had a lot of panel discussions here on this webinar on being persuasive, on how to debate issues in a caring way. So the question here is, do you have any guidance on having those tough emotional exchanges about the importance of having access to full reproductive health care? Do you have any advice for those of us who are trying to break those barriers with our family and friends?
So I can take a stab at that one. I would say really the most powerful way is really through personal stories. And so the more you can link your personal story to, say, that elected official, or even to your family and friends, to really get them to really understand, you know, the importance of access to abortion or reproductive health services, is really being able to tell some of those powerful stories. And for elected officials, even local stories are very powerful.
Thank you. Thank you. Thank you so much. If anybody wants to add to that, let me know. The other question we have, which is good, and this is another question, another area that doesn't get talked about a lot, which is how can we support more medical training on abortion so that the medical profession in the US is uniformly able to provide care? We know that this is an issue. It's not uniformly taught in medical school. And one of the things that Mike Bloomberg did as mayor here in New York City is really make that happen. That was mandatory basic training in the medical schools here in New York City. Anything to add on this subject?
I wrote this into the chat, but this is another place where the Hyde Amendment just messes everything up, because Centers for Medicaid and Medicare are the #1 funder of graduate medical education in this country. And as a result of that, they are not able to fund training on abortion. So it is, and it's oftentimes considered, you know, like if somebody wants to get training around abortion, it's considered elective training, right? So they have to go out of their way during an extremely stressful and busy medical education process as it is to go figure out how to get trained. And when 1 in 4 women in America are getting an abortion, and this training is applicable to other types of medical procedures, it's ridiculous that it's not considered part of basic medical training. And then, you know, don't get me started about medication abortion, but I see Elizabeth nodding along, so she probably has stuff to say too.
That explains why we're in the predicament we are. The Hyde Amendment, you know, rolled out in 1978. It's just been we've lost all of this training of doctors over decades. Elizabeth, you wanted to add something?
I'll just quickly add that in addition to Hyde, public state schools that are governed by particular states, there are lots of hostile state legislatures that have passed similar rules around medical education. So not to really Pollyanna this, but we have to talk to people, right? We have to announce our own support for abortion rights and abortion access. And then we have to tell elected officials at the local level, the state level, and the federal level that this is critical to us and they can no longer take the votes that they have been taking.
Okay. I'm going to be going over time. I'm going to get in trouble, but this is an important question that's come from Donna, and it has to do with birth control. We didn't really get to talk about that. Obviously, the key way for people to plan their families and to avoid unintended pregnancies and the need for abortion. We've had the recent court ruling. We've had a lot of challenges in the courts that employers don't have to cover for religious exemptions. Religious organizations have to cover it. It's very concerning. And and the Affordable Care Act, having the no co-pay birth control, huge for women. Can anybody just break it down quickly, where we are, the threats to birth control? And again, I'm sure the advice is a lot the same, but can you talk a little bit about that?
I'll just start briefly and say opponents of abortion rights would not be satisfied with just being able to prohibit abortion access. They are also opponents of birth control. They're opponents of sex ed, right? And so what we see are people who are really trying to stop all access to care, information about our bodies and our health. And so these are combined and coordinated efforts. And what we have seen recently is that in the Supreme Court, as you just mentioned, right, we saw them vote for the status quo in terms of abortion access in Louisiana. We also saw them we saw the justices and their opinions in the birth control case really not understanding how important contraception is and how people access contraception. And so, these are all coordinated and combined efforts, and we need to be vigilant in all of these areas so that reproductive health care writ large is available.
Thank you so much. Can we just end with literally 20 seconds from each of you about, in light of everything we've been talking about, what gives you hope for the future? What are the next steps and what gives you hope?
That we are, I would say that the next 100 days, we are maybe 97 days now to the next election. I guess as you said at the top of the hour, we have the opportunity to get out and vote and elect a new White House, hopefully take the Senate, keep the House, but then from that also be able to really push our agenda in a new Congress. I think that's what's hopeful. There's an opportunity, a new opportunity to really change the way our government looks, and including the Supreme Court, could get a new Supreme Court.
And including the Senate. I mean, things are looking really, really good, I think. Anyone else? Well, thank you all so much for taking your valuable time. On behalf of the National Organization for Women and our sister organization, Women's Justice Now, we thank you for all of the incredible work that you're doing. It is hard work, and you have to be tenacious to do it. But we've seen from you directly, the women on the front lines making this happen, and we look forward to working with you and partnering with you moving forward. The best to you as we continue to get through this pandemic, and to everybody watching. We're going to be taking a break in August, so we won't be online, but as soon as we're back after Labor Day, we will have another series of informative, important topics for you to take part in, and we'll be sending out information. We hit the 100 days until the election just recently. I think, Tammy, you said 97 days now. We will definitely be giving you all the information you need to take as much action as you can to convince and help people in other states, vote in their best interest. So thank you all so much. Thank you, everybody who's been participating, and we'll see you soon. Bye.